third stage of labor is equally important as the first and second stages of labor. Yes, we are so happy to have our baby here. We've done the hard work. We are reaping the rewards of our efforts to grow this little tiny human, but now we need to get that placenta out. So today we are going to cover what a retained placenta is, why it happens, and what happens to relieve you of that issue. You know that in order to have your baby, you have to go into labor and dilate your cervix and then push the baby out. But what about what happens once the baby is out? What I just covered was the first and second stage of labor, but there's a third stage of labor that literally no one talks about. The third stage of labor is delivery of your placenta, and sometimes it doesn't go as we expect it to. So let's talk about it so that you are prepared, well-informed, and come into labor knowing everything that you need to know to be successful. Hey girl, hey, it's your birth bestie, Nurse Rini, and I am back with another fantabulous video for you. I have served hundreds of families just like yours, and I was able to inform them so that they could be ready, and I am here to do that for you today. Welcome into the Birth Prep Lounge, where we go over the things that no one else on the internet is talking about. Now, so let's run it back real quick. For those of you who are not informed, we don't shame anyone for not knowing, and we don't make fun of anyone for not knowing. I'm going to quickly tell you what the placenta is, its function, and why it's important. So the placenta is a very specific organ to women, right? Only women can grow a placenta. Only pregnant women can grow a placenta. It is literally what helps your baby thrive inside of you. So the placenta provides oxygenation, blood flow, and nutrients to your baby. So as I just mentioned, the placenta has a major role in the development and nourishment of your baby. But once you deliver your baby, its job is done. So what typically happens is your placenta will deliver shortly after you have your baby, if it's vaginally. If you have a cesarean section, then the doctors will go ahead and remove the placenta for you. However, again, through a vaginal delivery, you get up to 30 minutes to have your placenta delivered. And usually it's a non-factor, but there are 1 to 3% of pregnancies where placentas are retained, meaning at the 30-minute mark after you've had your baby, it still isn't budging. Now, there are levels to this that we aren't going to get into here because we're going to keep it brief like we always do, but you have situations where the placenta won't detach from the uterine wall at all. It may detach in pieces, or it may be embedded so deep into the muscle of the uterus that it's a whole nother medical situation that can be really complex, which was hopefully diagnosed before you had your baby. So just to let you know, the placenta not coming out is not your fault at all. It is no fault of your own. It's one of those things that can just happen. Are there things that put us more at risk for it? Yeah. So let's talk about it. Some reasons that your placenta may not want to come out is because your uterus has worked very hard during labor and it's done so after the baby is out. So you may have those weak contractions when we still need some pretty robust contractions to get that placenta delivered. If you've had a previous C-section, the placenta may attach and grow into that previous uterine scar, or like I said before, it could grow too deeply into the uterine wall, which is an accreta spectrum situation that's, again, too deep for us to go into here. But sometimes it just doesn't come out. I mean, some things are just a fluke, right? Some other risk factors include preterm labor, a prolonged labor, an induction of labor, and more. So it can be any of those things, and it could be nothing at all, and you could still have a retained placenta. So let's back it up a little bit and talk about what happens after you actually deliver your baby. Once the baby is out, they will put the baby on your abdomen. Your baby will still be attached with the umbilical cord attached to the placenta, which is still inside of you. Okay, and then the doctors will do delayed cord clamping as long as your baby is stable, and then they will move the baby up to your chest so you can, do skin to skin and hug and all of the things, right? So then what happens is the doctor orders the nurse to start your Pitocin bolus, right? So this is called active management of the third stage of labor, meaning we are trying to actively make sure that you do not bleed. Okay, so active management of the third stage of labor. We are trying to actively get that placenta out by giving you bolus doses or large doses of Pitocin to cause those uterine contractions and to help it expel the placenta. Don't get me wrong, your doctor isn't yanking the placenta out. What they may do is give a little gentle traction, like, is it giving some slack? Okay, we're getting there, right? And then they'll just wait. Then they'll try again. And they may say, go ahead and give me a little push. And you push and it just pops out. But in some women, it just stays attached and you're like, it's not coming out, right? Or you get it out and the doctor's like, yay, the placenta came out, or the midwife. But then they'll hold up your placenta and they're usually looking at it and turning it around because they want to make sure that they got all of the pieces. If you do not get the placenta out in its entirety, or it doesn't come out at all, you are at risk for a postpartum hemorrhage. So we really want to be timely about extracting it, or you expelling it and getting it out and actively managing that situation so you don't have a postpartum hemorrhage. Again, if the placenta does not come out on its own, the doctor may be able to manually remove it. They may go in, you're still numb if you have an epidural, okay? They'll go in and they'll remove it. Again, the risk with that is they may not be able to get all of it out in one piece. In rare cases, you may need to go to the operating room for a D&C. I know no one talks about it. It sounds super scary, but it's okay. The important part to know here is that it can happen, but if it does happen, your team is well-versed, well-trained in managing it. Again, they do look at your placenta after they remove it, but sometimes there's still pieces in there that they didn't know that they didn't get out. And it can also happen in a C-section. It just doesn't happen as often as it would a vaginal delivery. In this case, what you want to watch out for, mom, is heavy bleeding, and your nurse will also be watching out for that. Extreme abdominal cramping after you've had your baby, okay? Could be a sign that maybe your body is trying to push something out. Or signs of infection like fever. If your placenta does not come out on its own and your doctor has to go in there and either manually remove it by hand or go and take you to the OR for a D&C, they will give you antibiotics because that does put you at an increased risk for infection. So usually I think antibiotics are for like 24 hours by IV. The key thing that I want you to know is that this is something that can happen. It happens in 1 to 3% of deliveries, and I don't want your first time hearing about it to be when you actually experience it, right? But also know that if something feels off once you've gone home, let your doctor know. If you you can't quite put your finger on it, but you're having a little more pain than you think you should be having, or you're pushing out large clots or something that looks like tissue, then you're going to go ahead and call your doctor and or go to the emergency room so that you can be evaluated. Just because your baby is born doesn't mean childbirth is over. No, we have to get that placenta out as well. Uber important. In the rare event that you have a retained placenta, it's not something that's going to blindside you. You are going to be ready and prepared. You're going to say, oh, Nurse Rini mentioned that in her video. It does happen. It's rare, but also it does happen and they know how to handle it. So, you know, that you feel comfortable and empowered and informed. Going into childbirth, this is what we do here in the Birth Prep Lounge. Let me know if you've had a baby before and you've experienced a retained placenta, or if this is something you've never heard of, let me know in the comments. I want to know that this information is getting to my girlies who want it. And I also want to know whether or not you knew about it. All right, make sure you like, comment, share, and follow for more, and watch this next video that I leave for you. Bye.
Now where do we go from here? Tell me.